pain in the head, neck, and face tends to be experienced worse than pain in other parts of the body. Let's use neuroscience to try to figure out why this may be. First, let's meet your trigeminal nerve. The trigeminal nerve is a cranial nerve that goes into the head and face, and it innervates different structures like your teeth. It goes into the jaw, it goes into all the structures that feel sensation on the face, and it goes into the meninges, which is the outer covering of the brain. All these areas tend to be pain-sensitive areas, and the information for pain is going to be transmitted through the trigeminal nerve. It goes into the brainstem, and then it travels down into a part of the spinal cord called the trigeminal cervical nucleus. That trigeminal cervical nucleus is also unique because the C1, C2, and C3 nerve roots that also transmit pain from the upper neck are also going to meet at that nucleus, and this convergence of fibers coming from both your trigeminal nerve and your upper cervical nerve roots can often mean that pain coming from the head and face can also be experienced with pain in the neck, and pain in the neck can also generate an experience of pain in the face and pain in the head. From there, it follows the normal pathway from pain for the rest of the body, so that information will go up from the spinal cord into the thalamus. So the thalamus is that sensory relay center, which is going to transmit that painful information to the somatosensory cortex. And the somatosensory cortex gives us our final experience with a painful stimulus. One of the things that we haven't touched upon yet is this idea that all pain also comes with this unpleasant emotional experience along with the painful sensation. And this painful or emotional sensation is going to come through an area of the brain called the limbic system, which includes things like the amygdala and the medial frontal cortex, which gives us our sense of monitoring what's going on inside of the body. I bring this up because our experience of pain and the severity of pain may not be directly tied to how much damage was done to the body. Sometimes it's associated with how much of an emotional experience that we have with the pain in of itself. This paper started to look at some of those connections. It's called a craniofacial specific monosynaptic circuit enables heightened affective pain. And what this paper looked at are some of the neurological pathways that might explain why facial pain is experienced in such a worse way than pain that is experienced in other parts of the body. So the authors found that with the trigeminal nerve, there is a direct connection from the trigeminal nerve fibers that goes into an area of the brainstem called the parabrachial nucleus. The parabrachial nucleus is an autonomic type of nucleus that has a direct connection into those emotional limbic centers of the brain. When we experience pain in other parts of the body, like in our back, into our arm, into our leg, there are multiple stops along the way in order for that pain signal to get to the parabrachial nucleus. But for facial pain through the trigeminal nerve, there's one single stop, which means that the sensation that comes from the trigeminal nerve gets to that parabrachial nucleus much faster than, say, a pain in the lower back. In neurology, when we talk about these direct connections, we call them monosynaptic. And these monosynaptic connections tend to take higher priority inside of the brain, meaning that because the trigeminal nerve only takes one neuron to get to the parabrachial nucleus, it has a higher priority than pain that might come from the lower back that might have multiple connections to get to the same place. From an evolutionary perspective, this makes sense because we have to do things to protect our head and neck at all costs. Whenever something happens to our head and neck, it should take priority because this is a greater threat to our life and our existence than something bad happening to our back or into our arm or some other parts of our body. You guys could probably speak to this if you've ever had something like a toothache, where a toothache tends to be a really terrible sort of pain for people, even though the amount of damage that has happened to the tooth is actually fairly minimal. The reason we bring this up is because pain in the face, including things like trigeminal neuralgia, chronic headache disorders, temporomandibular joint pain, tend to have a high emotional burden on the patients that suffer these disorders. And there also tends to be a higher level of suicidal ideation whenever people have these craniofacial pain syndromes. So it shouldn't be surprising whenever we take care of a patient with one of these disorders that these patients are often having higher levels of depression, higher levels of anxiety, and higher levels of suicidal ideation. But on the flip side, when we are able to meaningfully reduce the pain in these patients, that you could also start to see their mental health improve as a result of that.